Yeah, I had the opportunity to speak one-on-one with the Deputy Secretary of Veterans Affairs and ask him what the department plans to do to make sure veterans can get the help they need in a timely manner. On Monday,
and getting people who had shared experiences or understand each other's experiences in the same space is important.
You heard from Lyle Freed of Beach House Center for Recovery in Juno Beach, which offers a treatment program specifically for veterans and first responders.
Starting in January of 24. It's almost like there was a spigot flowing and they just turned the valve and it just stopped.
He shared his concerns about the Department of Veterans Affairs cutting back on community care referrals under the Biden administration amid ballooning costs. The community care program was created during the first Trump administration. It allowed the VA to refer veterans to private providers and foot the bill. But amid recent VA staffing reductions,
because I know that we haven't really expanded the VA system, so my guess is there's just less care being accessed.
The VA is going to end 2025 about 30,000 employees lighter than it began the year. How do you expect to impact care?
It should have no care. In fact, quite frankly, it may even make the care better.
Paul Lawrence is the Deputy Secretary of the U.S. Department of Veterans Affairs. He tells me the widespread reductions in force were intended to reduce red tape.
So we hope by eliminating positions that were, quite frankly, as the Secretary says, bureaucratic in nature, not contributing directly, that we free up resources that we can use to hire more doctors and provide more care.
Are community care referrals something that this VA wants to start back up again?
Sure. Let me see if I can kind of put it in context. This was something President Trump championed in his first administration. We don't understand why the last administration chose to break the law, quite frankly, and not offer choice. But yes, we intend to offer choice to our veterans more strongly than the past. In fact, we just changed some rules to make it easier, fewer referrals to get to the community. So yes, absolutely.
When I spoke with Freed, he said he had not yet seen an increase in those referrals.
Do you know what the timeline on some of this action is going to be and when we could start seeing it in our communities?
I don't know about the specifics, so I'll have to learn more about that. But we wish that wasn't happening. We need to train our folks better. I've heard this elsewhere, but no, that is not the intention. We want to offer care in the community if it works for veterans.
Now, Lawrence encourages any veterans in need of help to go to their local VA facility right away. And of course, I'm going to continue to follow up with Veterans Affairs and providers in our community to see how the number of referrals changes in the coming months.